Hello everybody, thank you very much for joining. My name is Louise Roberts. I'm a senior lecturer in social work at Cardiff University, and I'm also part of CASCADE, which is the Children's Social Care Research and Development Centre. The title of my presentation today is Young People in and Leaving Foster or Residential Care Who Are Parents, Research Findings from a Mixed Method Study in Wales, UK. So I'm going to turn off my camera so that you can see the slides fully. So my presentation today is based on a 5-year research study that I led between 2014 and 2019. The idea for the research came from young people connected to Voices from Care Cymru. Voices from Care is a national organisation in Wales which supports young people and adults who have experience of the care system. I may say care experienced young people throughout the presentation, and by that I mean young people who have experience of foster care or residential care or kinship care. The study included various different phases. It included interviews with parents looking back on their experiences. It involved interviews with parents who were about to have or just had a child, and I followed them periodically over the course of 12 to 18 months. It involved interviews with professionals. So in Wales, there's a statutory duty to support young people as they transition from care up to a maximum age of 24. So I interviewed professionals from each of the local authorities in Wales. We have 22 local authorities. In Wales, we don't have data which tells us each year how many parents we have in or leaving care. And we also don't have any information about the outcomes for children and families. So within the research, I wanted to provide a picture of current parents, and I'll say a little bit more about that as we go on. And then finally, the research involves some secondary analysis of existing national data sets within Wales. Today, I'm really limited on time. If you are interested, on the right-hand side of the slide is the front cover of my book, which was published in March last year. At the end of the presentation, I'll tell you where you can download the book, and it is free of charge. Today, I've just got time to do a sort of a brief overview of some key findings in respect of outcomes for children and families, some sort of key findings in respect of experiences and perspectives of both parents and professionals, and I'm going to talk through some issues of support. So first of all then, outcomes. We collected data from 20 out of the 22 local authorities in Wales for this phase of the study. With the help of leaving care teams, we identified 258 parents aged between 16 and 21. We identified 238 children and 44 ongoing pregnancies. We asked a series of questions in terms of the support needs of parents, the numbers of children, the ages of children, the services that families were involved in, but we were particularly interested in terms of family outcomes, so where children were living and the legal status of them. And we found that 74% of children were living with at least one biological parent, but 26% of children were separated from both birth parents. So 1 in 4 children separated from both birth parents. 10% of those were in foster care, 9% had been adopted, and 7% were living with friends or family. If we think that in Wales, around 1% of children are recorded as being in care each year, to think that 26% of children born to care experienced young people were separated from them, the concerning levels of separation become clearer. So how do we make sense of these concerning outcomes? And the qualitative data generated with parents and professionals is helpful in this regard. So first of all, both parents and professionals talked about stigmatized views of parents. There's a potential to question and be concerned about the influence of past experiences on a young person's ability to be a parent. So the idea is you didn't experience good parenting, therefore you don't know what it is to be a good parent. It's important to say that young people felt really strongly that this was unfair, because they said that they used their experiences as a way of sort of informing their approach to children. It provided a means to say, that's what I don't want to do, that's what I don't want for my child. They wanted to be better and do better for their children. The research also highlighted evidence of systemic disadvantage. One example of this was an increased likelihood of assessment, social work assessment, particularly when young people first said that they were expecting a child. Across the 22 local authorities, we found some that said they automatically refer young people for a parenting assessment when they find out that they're expecting a child. And they said the reason that they do that is because they know that, most of their young people will have additional support needs, and they wanted those assessed and responded to at the earliest opportunity. In contrast, you had more local authorities that said, well, we used to do that, that used to be our practice, but we recognise now that that's discrimination, that isn't the experience of other parents who haven't grown up in care. So we don't do that. However, despite the fact that we don't do that, young people are still more likely to experience a parenting assessment because referrals will be made by other professionals, particularly health professionals. And then you had local authorities somewhere in the middle, and they said you won't find it written down anywhere, and this is the quote that I've put on the right hand side of the slide, but there is an expectation from senior management that they will be referred on to children's services as unborn. So, even though the policy is not explicit, it's not written down, you won't find it anywhere, but professionals knew that they were expected to make those referrals for a parenting assessment. I also wanted to touch on issues of support, and the research found evidence of disadvantaged access to support. So professionals in particular emphasise the importance of young people having informal support available to them. This notion of having somebody by your side, because parenting for anybody, regardless of circumstances, was recognised as being both rewarding but also really challenging. And the support could come from partners, family, birth family members, former foster carers. It could be a range of different people, but it was seen as really important that a young person had somebody that they could rely on, that they could turn to. Because unfortunately for the young people who didn't have that support, who were more reliant on state support in terms of parenting, then the availability and the adequacy of that support was seen as a really poor substitute for what you would ordinarily expect to be available from birth families. The quote that I've put on the right-hand side of the slide is from a parent who sort of talks about, being on her own, being really frightened and lonely. And she was an example of somebody who didn't have that support network. And so, she wanted more support from professionals, but that wasn't available necessarily in the way that she would have liked. So this brief talk then has highlighted some key issues from the research in terms of outcomes, and we've talked about concerning levels of separation. We've highlighted some issues of stigma, discrimination and disadvantage from the experiences and perspectives of both parents and professionals. And within the research, there was evidence of variable support and underdeveloped support. It's important to say that these findings are not unique to Wales, and the references that I've included at the bottom of the slide, they're all reviews of the evidence from international reviews of the evidence, and they span from the beginning of the 1990s all the way through to 2020. And these issues that I've talked about today are familiar within these review documents. So finally, as I said, if you would like to know more about the research, please have a look at the book. It is free to download at the web address at the bottom of the slide. Something that I often say in my presentations is that if you do nothing else, please just download the book and scroll to the end, because it ends with a letter from a care experience parent. Her name is Jen, and she's done lots of work with us throughout this project. She really succinctly and powerfully summarises some of the key issues that have come up over the course of the research. And she makes an important plea at the end of the letter that the research isn't the end point, that something positive comes from all of this work. So she says, I hope that the book brings together care experienced young people and parents, midwives, health visitors, social workers, personal advisors, senior managers, government officials, charity workers, volunteers, anyone and everyone who can make a difference. I hope this is the start of something better. And as part of that, I hope that you will listen into the presentation following this by Rachel Vaughan, because Rachel is going to talk through the work that we've done since this presentation in order to try and encourage policy and practice change. Thank you very much for listening. These are some of the references that I mentioned during the talk, or I featured on the slides. If you would like to get in touch with me to ask any questions, then please feel free. My email address is at the bottom. Thank you very much. Enjoy the rest of the conference.